All right. So this is one of several application workshops that we're hosting. We're really pleased to have the Latino Coalition for Community Leadership be leading these application workshops. Just for a little bit of context, the Justice Reinvestment Equity Program includes a capacity building grant, and we're really excited to have contracted with the Latino Coalition for Community Leadership to provide that hands-on coaching and technical assistance for grantees. And so these application support workshops are to help organizations that are interested in applying with a little bit of extra support along the way. And I think, at the same time, it's a great opportunity for organizations to also get a sense of how the Latino Coalition for Community Leadership operates. So with that in mind, I'm going to go ahead and just pass it to Crystal to take it over. Thanks, Crystal.
Thanks, Cleo. Okay, so today we're going to learn a little bit more about the Latino Coalition for Community Leadership and myself as a facilitator, discuss these workshops, application workshops that we're doing both on project plan and budget administration, look at the admin needs for the JREP application itself, budgeting guidance and preparing that project budget for your application, and then open it up to questions and answers. And so here's a picture of some of us. With us today on the call is March Runner, our state director, and Tanya Castro, our senior program manager. And so March, do you want to just quickly introduce yourself so people can see who you are?
Welcome to the workshop. Hi, I'm March Runner. I am, as Crystal said, the Oregon State Director of the Latino Coalition, and I'm looking really forward to working with everybody.
And Tanya, do you want to introduce yourself?
Tanya, you're muted.
Yay. Hi, everyone. I'm trying again. Tanya Castro. I use she, her pronouns, and I'm the program manager. So great to be with you all today.
So the Latino Coalition for Community Leadership was formed 20 years ago this summer, actually, as a response to small grassroots organizations not accessing federal and state grant funding. And so it really was looking at where the money was going, why there were community groups not either able to access it from grant writing or just not even trying, and what those kind of barriers were. And then as that response, we work with nonprofit organizations themselves. We don't do direct service. And so we're really focused on the capacity building of community-based organizations to really strengthen them and their work that they're doing in the community. So the Latino Coalition for Community Leadership was contracted with the Northwest Health Foundation to provide capacity building, training, and technical assistance to JREP grantees, with the goal of strengthening these organizations throughout that 27-month grant period, and also with the additional goal of helping to access state or other types of resources to really kind of improve that sustainability. I have been with the Latino Coalition for 10.5 years, but prior to that, I worked in nonprofit development, doing grant writing and events and other types of resource development. And prior to that, I worked with youth reentry. At the time, it was 11 to 17-year-olds that were in incarceration, sometimes long-term incarceration, coming out and helping with youth reentry, as well as some intervention programs. So for JREP, we are doing 4 workshops. So we did 2 on Tuesday, we're doing 2 today, and then it's 2 each, a project plan twice and a budget workshop and administration twice. And these should be treated as complementary, right? So your grant funding amount is going to inform your project plan, and your project plan needs to inform your budget. So you won't really be able to do one without the other. And please, my guidance, do not write both in a vacuum. So they need to kind of speak to each other. So the best proposals will have both sections that inform each other, right? So what you're saying in the proposal needs to be reflective in your budget. And then the budget needs to reflect like this this could actually work of what the program design is. If you are responsible for both sections, I recommend that you switch kind of between them as you write. So you don't do one and then get to the other, because again, that budget's going to define what you're saying you're able to do. And then what you say you're able to do is going to then say what budget categories and budget lines you need to provide resources to. If you use other staff or volunteers for certain sections, like if you're writing and someone else is doing the budget or vice versa, then coordination as a team is key to really talk with each other. Jumping right in, page 5 in the RFP guidance discusses eligibility. And so this eligibility, applicants must be based and working in Oregon, and then applicants must be organized as one of the following: either a 501c3 nonprofit organization, a project or program with a 501c3 fiscal sponsor, and that fiscal sponsor and that project need to have a written agreement, sponsorship agreement in place before the application, right? Or a federally recognized tribal government. And so applicants based in Oregon, if you are not based in Oregon, but are working as a service area, right? So what that address is, please check in with the Northwest Health Foundation program officer, either Cleo or David, if you have any questions regarding this, of what that looks like for you. Also, the application itself and the portal asks for your EIN number. So if you don't know your employer identification number, that will be on your IRS nonprofit letter. Go ahead and look for it, because that's how the Northwest Health Foundation and the grant review is going to determine if you meet that criteria for eligibility. If you don't have 501c3 status and you're not also a tribal government, you'll need a fiscal sponsor with a written fiscal sponsorship agreement. And so don't wait until July 12th to kind of figure that out. Start working on it today to identify the fiscal sponsor and what that agreement will look like. And, you know, it needs to be that relationship, right, for that agreement from both parties to be able to establish that by the deadline.
I do have stuff, but
Is there a question? Okay. A fiscal sponsorship may have budget implications, right? So a lot of times the fiscal sponsor may take a certain type of fee, either a percentage or a flat rate, because they also have expenses in administering a grant. And so if you are a project and you need to identify a fiscal sponsor, that'll be part of your agreement, but you also have to think through what that budget implication will have, because you'll need to work that fee into your grant budget. Page 17 in the RFP guidance discusses the grant agreement. And so this is if you're awarded, right? So this happens after you apply, and then Northwest Health Foundation selects you for grant funding. You'll need to do some certain things. So to be a JREP grantee, you need to be registered with the Oregon Secretary of State. You'll also need to be registered with the Oregon Department of Justice, and you'll need to meet state insurance requirements. So again, these 3 things are not required until awarded, but I wanted to point them out now just so you can kind of see what you'll need to do if awarded to be able to receive funding. So the Oregon Secretary of State website is listed right here. Also in the RFP guidance, it is a hyperlink, so you can click on it through there. And then I did a screenshot on the left here where you can use the Finds button to look for your organization. You should already be listed if you were incorporated in Oregon as an entity, but you may need to renew or update it. If you have never filed, you'll need to file. And so you can click that file button and start to register and go through that process. The Oregon Department of Justice website is listed here. Again, it's also a hyperlink in the RFP guidance. You'll want to use the search button to look for your organization. If you're not listed, to use the register button in order to register. So page 27 in the RFP guidance is the financial information. And so that's where we'll spend the bulk of today, kind of discussing what this looks like. So there's 3 parts to this. The project budget for your proposed work. That is a budget template that Northwest Health Foundation has provided, or you can upload a budget in your own format, right? That provides the same information. So you're welcome to use the template, and we'll look at that today, but you're also welcome to choose a format that best provides the information and how you think about yourself and your organization. Another piece is an organizational budget for the current fiscal year. No template is provided. Hopefully your board of directors has approved one. If they haven't yet, you can go ahead and use just a yearly organizational budget with some of these same line item categories, and to please provide it for the current fiscal year that you're in. And then finally, financial statements for your organization's last completed fiscal year. So those can be internal statements, maybe they were shown to the board or board approved. They can be reviewed by a third-party administrator, like a CPA firm, or just like independently reviewed, or they could be actually audits, right? So financial audits. So there's lots of choices here on what you may have yourself as an organization. And if you cannot provide this information, maybe you've never put one together before, and you're a brand new organization, then for this section, you'll just share what you think your organization needs to develop it. And also please be aware that if you do not have financial statements, you really should be applying for the capacity building grants, project grant, because the Latino Coalition for Community Leadership, if awarded, could then help you with this. So again, the project budget, Northwest Health Foundation has a template, and we'll look at it in a minute, or you can upload your own. And the financial statements, don't have them or don't know how to create them, the capacity building project grant will be the right fit for you. So here's what the budget template looks like that they've provided. Again, you can use your own template. This template doesn't need to be used, but we'll be looking at some of these budget categories today. On the left-hand side are the different line categories. So like use the term line items. Those are the different expense categories that we're looking at in order to kind of determine where the budget is going and where you'll be spending funding. The template itself is broken into 3 budget periods and then a subtotal for the entire 27 months. So the first budget period is for 3 months, October 1st through December 31st. The second one is for the calendar year of 2024. And the third budget period is for the calendar year of 2025. Again, if you and your organization think differently, if you're on a different fiscal year, if you want to present this information differently, that is completely up to you. You're welcome to do that. We just want to see that the budget subtotal equals to the grant amount that is listed in the RFP for either the project grant that you're applying for or the capacity building project grant that you're applying for, and have a length of time of 27 months. Also at the bottom of this template, I just really wanted to point out that the budget template that Northwest Health Foundation has provided is locked. And that means that there are cool Excel calculations that are built in there to really help you, subtotal, bring all your periods together and do all of that. And you're less likely to have errors, right? Because it's all been built out for you and then it's locked down. There's also a second tab that has a glossary of terms. And so if there are any words or terms here that are confusing, maybe you don't think think of those categories in the same way. There is a second tab with great definitions for everyone to kind of look at to understand. And if you have any questions, please reach out to your Northwest Health Foundation program officer. David or Cleo offer office hours to really ask questions and dig in deep for any specifics. So the budget categories for the Northwest Health Foundation template are personnel, travel, facilities, project-related, and indirect. And we'll be going over those in the next couple of slides. But really want to point out, you can also use your own. So if you organize yourself in a different way as an organization, you're welcome to share other types of budget categories that you have expenses to that you need. And you're able to adjust them to make your own so that it really is a true reflection of the project that you're proposing. And again, the budget template is broken out by calendar year, but you can use different columns based on how you think of your own budgets. So for personnel, and this is where we'll really kind of mirror this the project design workshop. So if you haven't attended that, please do either this evening or both of these workshops will be on the Northwest Health Foundation's JREP site for you to access later on, because they really are meant to be complementary. So for personnel, you need to think about your staffing on the project. Will it be consistent over 27 months, or will staffing kind of change depending on if it's a planning period or a program services stage? Do participants stay with your program? Like how do they enter and how do they exit? What is that time frame? And so you really, if you have participants coming in the first year and they stay with you a long time, your second year staffing may need to be bigger, right? Like more staff time develops for those participants in the second and later in 2025 than they do right at the beginning. So really kind of thinking through your program service design to be able to answer those questions on your staffing. And then what is your compensation plan at your organization? So you're looking, will there be salary over the 27-month period where there'll be salary increases or small bonuses? And you're not going to be able to get them unless you plan it, right? So imagine it, plan it, and then you can get it. And I always share like an anecdotal example of, for the Latino Coalition for Community Leadership, we started out small. And so when I came on 10.5 years ago, and we were grant writing, we said, okay, who wants a raise? Like who gets a raise? Like build that raise into that budget and like cross our fingers and hope we got it. And then when we were writing for the next one, that's when we decided, but if that term was for 36 months, then that was your salary for 36 months until we got some more funding. And so if that is you, there's better ways to do this, right? You can think about your budget in a way that really looks at, what is the pay scale for October 1st of 2023 versus what is the pay scale for, December of 2025.
Just don't think he does give raises.
Is there a question? Okay. And then also, well, as you're budget planning, just remember that there's labor laws. So Oregon has a minimum wage rate. You'll need to pay minimum wage at the very least. There's a standard appointment metro in non-urban counties. And just kind of, again, think about, rate increases in, or potential rate increases in 2024 and 2025 of what that is. So for hired staff, you must pay the minimum wage, that's the law, right? You must pay federal and state payroll taxes, which is your FICA, your unemployment insurance. And also you must pay for workers' comp insurance, and that is an insurance requirement that Northwest Health Foundation has for their grant compliance. So the Latino Coalition usually coaches to budget for about 10%. That's not for these different categories of French. That's not the best total estimate. It's probably a little bit high, but your rates could differ based on your organizational size, your payroll size, as well as any previous claims you may have had for unemployment or workers' comp. And so if you don't know, don't have last year's to really look at and get a good budget idea for, we recommend to budget for 10% total. And then as actual costs come in, you're always welcome to kind of adjust your budget after that. And then also, right, if you don't have employer benefits, if this is the first grant that you might be receiving, or one of the larger grants that you might be receiving, consider your staff, right? Consider the ones who are doing this work. And so medical, dental, retirement, etc. Think about what those costs could be, and really plan to support your staff.
I agree. I think she would.
So contracting is a line under personnel on the budget template, but I just kind of wanted to caution and just kind of look at, please do not contract just to avoid fringe. So if the last slide that we showed looks a little intimidating, and you're not really sure how to calculate, please don't just say, well, everyone's 1099 and this is the rate and we don't have to worry about it. There are IRS rules. You'll get yourself into lots of trouble here if you try to just contract instead of hiring staff appropriately. And so feel free to look at the IRS website and make sure that there's like some common law rules on behavior, financial, and type of relationship. There's some tests or some checklists that you can look at to see if someone could be contractor, if they really do need to be hired. And so just really look at that of who personnel could be or what contracting could be before, as you're budgeting and before you make those decisions. But I also want to add, there's lots of great ways to contract, and contracts do add value to your service delivery. So consider what contracts you may need. And those are both program contracts and maybe like administrative contracts. So program contracts may include trainers, both staff trainers, as well as trainers that you might have for clients or participants. Any referral partners that you may have, you may contract with them. There may be some sort of fee for referrals or curriculum development. And so I just gave you, a couple different examples of what program contracts could look like. Administrative contracts may include bookkeeping services, maintenance around your building, those kinds of things. And so really kind of look through what different contracts you may have, and don't forget to include them in your program budget. So for travel, please look at page 15 of the RFP. Northwest Health Foundation is really asking for everyone to budget for travel in order to attend JREP convenings, right? Because it's really kind of creating this like ecosystem and like this peer learning environment with all of the grantees. So from page 15, they're estimating that travel and lodging costs will be between $9,000 and $14,000 for 2 members from the organization to attend those over the 27 months. So please do not forget to put this in your budget. It's very explicit on page 15. And so really kind of hold some funding there for travel. In addition to that travel, you may have other types of travel that you need to plan for. And so there could be home visits with participants, there could be stakeholder meetings, there could be staff training. And so definitely, think through what the plan is for the 27 months, go back to your project plan and how you plan to operate, and put in additional resources there for any other type of travel that your staff may be doing for the project. If you have an organizational travel policy, great, you're already established. If not, we recommend, and we just use the default for the federal rate, which is the GSA rate. I've included the website there. The current rate changes every year, and actually last year it changed. It was January 1st, and then it was actually July 1st. And so this latest rate for 2023 is 65.5 cents per mile. And so that's just kind of how we calculate. And then when you're thinking about home visits or stakeholder meetings or kind of what that looks like, you can use that rate to then kind of determine how many staff you'll have on the project, where they might be going each month, and do a budget there for that staff travel. So facilities costs, facilities includes, your actual rent, your maintenance, your utilities, your internet, all of those different things. Most of the time, these costs are cost allocated. And by cost allocated, what we mean is that you may have multiple projects operating out of the same facility.
Right.
And so the JREP project would only take a portion of that. And so if you have multiple projects out of your same building, or off of the same, internet service, or just any of those other utilities, you'll only allocate a portion of that of those costs to the JREP program. And so just kind of thinking through that of what you have, if JREP is your only funding source, then 100% of your costs, right? 100% of this will go to facilities. So, so just kind of thinking through if you have a cost allocation method, and if you have other types of funding sources, of what that can be. I just also wanted to point out that other types of funders usually expect that these costs are administrative or indirect. So federal government, a lot of state governments don't allow for your rent, for example, to be considered a direct program cost. And so I actually think it's pretty cool, right? It's pretty innovative that Northwest Health Foundation recognized that a lot of these costs are actual program costs and not just administrative indirect. And then finally, if you do not have a building or you don't have rent, you would just have zero, or you wouldn't even list this as a optional program category. But then that should be reflected in your project plan as well. So project related costs, again, this goes back to your program model, right? Of how you provide services to the community and those you serve. And so how does your program model affect these, right, expenses? And when you're thinking through the different, if you're doing calendar years or fiscal years, the different timing, that should coincide with your enrollment plan, right? So you may not have really heavy costs in this for your first couple of months as you're enrolling people, and then those costs should build. Will you have incentives or participant stipends or supportive services? And, and again, mirroring that to your enrollment plan and your service delivery of what that looks like as you're budgeting. And so then just as examples, I've seen it done lots of different ways for these participant type of costs. Some programs offer certain support. So maybe they say, anyone who needs a bus pass or tokens, we provide that. And so they just have to say that they need it, or, whatever type of certain support that they offer. And so if there are participants that are lucky enough to, have a car or have a ride or live close enough to bike or walk, then they don't get this support, right? Because they don't need it. And it really is kind of needs-based, and other ones do. So they then would budget for a certain amount per month or year. And a lot of times this is kind of first come, first serve, right? So we have a budget of $2,000 for bus passes. We kind of allocate it monthly, and it just depends on who needs it at the time as to, how those resources are allocated. I've also seen it where programs kind of calculate an amount per participant. So they go back to their program model and their enrollment plan, and they say, for this, JREP project, we plan to serve 75 participants over the 27 months. And each of those participants would, have some sort of supportive service need for $100. And so therefore we will budget for $7,500, right? That's 75 times 100. And so the way that they then calculate that is they say everyone has some sort of need. We just don't know what it totally is just yet. But as they come in and as they say, maybe it's work clothes or a tool belt or, a fee assistance for education, or, they need 2 nights in a hotel, or any of those types of supports, right? We just kind of calculate that each participant will get about $100 per participant. Whereas other programs say, this is the type of support we provide, and here's our budget per month or per year for that. And the final category is indirect, right? So indirect allows you to budget for an administrative allowance, right? That's not necessarily like part of the project, but like in addition to. So you have some direct costs, right? And then you have indirect costs that are like make it really burdensome to kind of try to cost allocate. And so an example of this would be a ream of paper, right, in your office. You have no idea where those 500 sheets are going. And so it would be really, really silly for us to take that $7 and say, okay, 3 sheets went to making flyers here, and 30 sheets went to an intake form for this other project and go through. And so for a lot of these types of expenses, what indirect recognizes is there are just administrative costs with being a nonprofit. And we don't want to have to, cost allocate everything. And so, here's just a flat kind of rate. And then those costs can kind of be taken care of there. Northwest Health Foundation has been really purposeful and not providing guidance about a rate, right? So they decided to not say if there was a cap or if there was a certain amount you should take. And so really being responsive to everyone's individual program and organization and kind of where they're at as to what they think is meaningful for them. And so you'll need to decide as an applicant, right, what is a meaningful indirect rate for your project, and then use the budget notes to explain why. However, there's different ways to think about indirect, and so if you don't know, I'm happy to kind of give you a couple scenarios of what that can look like. So the most basic way to think about indirect is a set percentage of the project budget. So either 10% or 20% or somewhere in between. People say, 10% of our project budget costs are going to be indirect costs, and so they'll just set aside 10% of that project budget for indirect. You could also think about it, and this is really how most state and the federal government looks at it, is it's a set percentage of the project budget minus facilities or participant payments. And so what the federal government says here is that, there's direct costs to the project, and then there's like big ticket items like maybe paying for rent or paying for housing, right? If you're housing participants, that are like a huge cost of the project. Also, usually participant payments are just, a stipend check out to them. And so there's not that much of administrative kind of burden there. And so they take those types of budget categories out and then say, you can do a set amount, usually like 10% off of the project budget minus those kind of big categories. That gives you less indirect budget, right? Because you're taking things out. But that just so everyone knows, that is how the federal government looks at it if you don't have a negotiated rate. The other way to think about it is a set percentage off of personnel and fringe benefits. Usually personnel is your largest cost category, and so it is the most of that. And so doing it off of personnel and fringe is usually how most negotiated indirect rates are across projects. So you get to choose a method for your indirect, and you get to choose the amount, but then you'll just need to say what is meaningful for you and your project and why. So lastly, on indirect, the more indirect you take, the less funding there's going to be for program costs, right? And so when you're thinking about your project design, and you have, a high indirect rate, there's less funding to actually do the work, right? To do the direct service work of what you're proposing for JREP. However, less indirect, right? Like too little indirect means less infrastructure support for the organization's admin function. So I've seen it in many times where a project or an organization thinks that they will seem more competitive if they are 100% on the project, because it sounds right, like they can do more with the money. But it is just so hard to run a nonprofit without some indirect. And so I do not recommend budgeting for zero. Please budget for what you need. And then going back to timeline considerations, again, taking a step back and thinking of the JREP project as a whole. Project grants are expected to be able to start quickly. So if you are applying for that project grant, that budget amount is $225,000 over the 27 months. Your planning period is 1 to 3 months, and then you're into direct services, right? That implementation. And so those that are applying for project grants, when you're thinking about how to budget and that planning period, as well as like the staffing needs that you have, you will, this is a much quicker jump into service delivery and enrolling participants into the program and reporting on them. The capacity building project grants have a built-in extra $100,000 to receive capacity building services from the Latino Coalition for Community Leadership. So that's $325,000. They also have more time for planning. A lot of the organizations in this category maybe don't have a data system fully set up, need some more time thinking about staffing and organizational structure. Maybe they don't even have a payroll system or QuickBooks set up or any type of financial accounting software. And so just needing a little bit more runway before they begin enrolling participants, but also know that this means less time for services, right? And so as you're thinking about staffing and as you're thinking about your participant related costs, if you're taking 6 months planning, you've got 21 months of services with participants for the project. And then also thinking about what the JREP grant project period looks like for enrollments, and what does success look like, right? And so your project plan, and in our project plan discussion workshop, we talk about what success looks like as an organization. You're defining that for the project. But really thinking about that in terms of both your program model as well as your budget. If, for example, success is a 6-month mentoring relationship, then you'll need to have all participants enrolled by June 30th, 2025, to then be able to get to the 6 months to be able to report on those before the grant period ends on December 31st, 2025. So again, when you're thinking about staffing, when you're thinking about participant related costs and kind of what that looks like, really think about the timeline for the grant project as a whole, and really work through what those costs are going to be in those kind of different stages. Okay, I will end it there. And are there any questions? So Linda looks like, Linda asked, thank you for another great session. Can we please confirm where we will find the recordings for this grant? So we are recording 2 program project design workshops. I did one on Tuesday morning, and then I'm doing one again tonight, Thursday night. I did a budget one on Tuesday night. I did the budget one today. And so whichever one of those 4 is the best for both program design as well as budget and administration, we'll take the best of. And then they are going to put it on the Northwest Health Foundation website, JREP. And so I'm not really sure the timing of that, but definitely after this evening is done, Northwest Health Foundation will decide which one is the best, and they will post it then. And so then we have another question for where can the budget template be found? And so the budget template can be found, and I'm going to skip ahead just so everyone can kind of see, and then we'll come back to the slide. But the budget template, they have an online portal, and this is where you'll be submitting your application. And it is Northwest Health Foundation givingdata.com. And so when you go into there and you sign in, and kind of create an account, that is where you will find the budget template that Northwest Health Foundation is providing. Again, there's no need to use this template. You can use something on your own as long as you're showing 27 months and the total grant amount that you're asking for. And there's no template provided for your organizational budget to submit. And so you're welcome to use their template, but you're also welcome to create your own. Any other questions? There's another question. Will the slide decks be made available to? Yes, I believe that will also be posted onto the website with the recordings.
My name is Angela. I just had a quick question about organizational size and budget, and if there were limits either on the lower or on the upper end. That okay.
No. Lots of flexibility and also not lots of guidance for you. So there's not barriers, right? That makes the program pretty cool. But unfortunately, it makes it really squishy for you on your end.
Thank you.
Any other questions on the admin? Any of the grant agreement requirements, budgeting? On Tuesday night, we did have a question about ADA accessibility, and if that was allowed. I know that Northwest Health Foundation is working with CJC to see if construction costs, right, or capital improvements are allowable under the project. They will be posting the answer to that question once we find out a little bit more. But if anyone had that same kind of question, it's unsure right now if construction or capital improvements would be allowable. Okay, so just a couple of reminder slides for everyone. Applications are due by Wednesday, July 12th by 5 p.m. Pacific, not midnight, right? 5 p.m. Do not wait until the last minute to look into the Giving Data portal and applying. So really, I invite you to create an account with the Giving Data portal. You're able to save a draft and really kind of start working in there to see everything before the deadline. There's information there for the portal for the application. I always recommend as a grant writer to look at the questions in the RFP guidance or in the portal, but do everything in Word first. That then allows you to copy and paste them into other grant applications that you might be doing in the future, right? You don't need to like rewrite everything brand new from scratch. And so by doing it in Word, you're able to kind of save your final draft. And then when you go into the portal, you can copy paste, right? And into those different sections. And so I definitely recommend to do it in Word. Save your Excel and your different things in a folder, so that way you can reference them outside of the portal after you've submitted. Northwest Health Foundation is also strongly encouraging a consultation meeting with either Cleo or David. The Calendly link is there. It is also in the RFP guidance and is also on the website for Northwest Health Foundation, JREP. And so please reach out to them to do any type of consultation or ask any questions. Before I go on to the next slide, we do have one more question. So capacity can include hiring personnel, correct? Yes. So what Northwest Health Foundation has recognized is that working, the way that we talk about it too is working on the organization instead of in the organization, right? So when you're doing direct services, you're working in the organization, doing those service deliveries to participants, but you also need time for either the executive director or senior staff or any type of leadership, right, to work on the organization, building that sustainability and that structure. And so that 100,000 that you are putting together in a project grant can go to personnel time in order to meet with Latino Coalition staff or work on yourself. You're also welcome to budget for consultants outside of us. And so we actually recommend, if you have any contracting for, other things that you would like to do for capacity, go ahead and include that in your budget of what that looks like. And then, just really making sure to budget for that travel as well. And everyone should be budgeting for that travel, either project grant or capacity building grant, in order to do those. For the capacity building that we're providing, Latino Coalition will be providing trainings either in person or by webinar. And so for in-person, we're hoping to kind of, be able to go around the state of Oregon and kind of meet you where you're at, but there may be some mileage costs for you. And we'll determine those types of trainings and subject matter experts based off of the different categories that organizations have applied to, if that's violence interruption, victim services, or reentry. So there's some good practice-based evidence EBT type trainings that we can provide, as well as other general type of trainings. And so thinking about that. So that extra 100,000 for capacity is going to go into probably multiple lines, like budget categories, when you submit. Great question. Thanks. Okay, so the next slide is accessibility. I showed you where the online portal is. If you would prefer to submit your application in a language other than English, or if the application portal is not accessible for you, please contact Quinn McNichol, the grants director at Northwest Health Foundation, and they will be able to, help with a solution for you. So please feel free to contact and kind of discuss through what your needs are. So we did, on June 13th, we held 2 workshops. Later tonight, I will be doing the developing a project plan workshop. You are welcome to join 6 to 7:30. And again, after this is done, the 2 best out of these 4 will be posted to the website. And finally, my last slide, key dates. So July 12th, 5 p.m. applications are due. July through September, there will be an application review process, as well as potential site visits to applicants. And so just, kind of be aware of that. The goal is for September 15th to have award notification to grantees with a start date of October 1st. And so October 1st would be grant disbursement, as well as that September 15th time to that October 1st time is your grant agreement. Again, don't forget the Secretary of State, the Department of Justice, and any insurance requirements will be part of that grant agreement. You'll have some time after signing, so you'll be able to sign probably, and then there'll probably be 30 days or so that you'll need to be working on making sure you're in compliance with the grant award. And then finally, the week of November 6th is the JREP kickoff. It'll be a virtual convening, but then all the grantees will get to meet everyone of what that looks like.